Now, there's the liver. We also talk about the biliary system, okay, because these lobes are divided into lobules, and then within the lobules we have hepatocytes, about millions of them. They are responsible for what? Producing bile. And then once they produce the bile, the left side and then the right side, we have the ducts within. They are narrow tubes that conveys this bile from the liver, okay, and then temporarily stored within what? The gallbladder. Okay, so I'm the right lobe, I'm producing. I'm the left lobe, I'm also producing. So after we produce them, then we need a conveyor, that is a tubular structure, narrow tube. That is the intrahepatic duct. Okay, so this is the left hepatic duct, this is the right hepatic duct. So they will drain all those that are being produced here. Okay, and then one forms one tubular structure here, one common duct. Okay, so we call this part what? The common hepatic duct. So the right hepatic duct, the left hepatic duct. Okay, and then they form one called what? The common hepatic duct. Now, once they have been drained from this part into this channel, that is the gallbladder. Okay, so we have the cystic duct here. Cystic duct. Okay, because this is the gallbladder being supplied by what? The cystic artery. Okay, so then they all into this channel, that is the gallbladder, okay, for temporal storage of bile. Now we also have the pancreas also into play. I think Joseph taught you that detailed anatomy of the pancreas, okay, and then we said for the pancreas, it is not horizontally aligned, okay, so anytime you are scanning, we don't scan in this direction. Assume you want to locate, you can scan it in this direction to find some part of them, but we mostly scan them in the transverse, okay, diameter, or oblique side, because the pancreas is completely aligned. So if you want to get the whole section, you place your probe in the epigastric radius like this, okay, and then assume you want to image a certain part, you can just place it here to take certain part of the pancreas. Okay, so oblique position. Okay, so your probe, assuming this is your probe, this is your marker, so facing towards the patient right side. Okay, now we have 5 parts of the pancreas as we learned. We have the head, we have the uncinate process, we have the neck, we have the body, and then the tail. Okay, so this part will be what? The uncinate process. Okay, this part will be what? The head. And then the neck this way. From this part to this part is what? The body. And then we also look at what? The tail. The tail of the pancreas. Okay. Now, we look at the duct within. Okay, it drains the pancreatic juices, okay, that is being produced by the pancreas. And then we have the common hepatic duct, the common bile duct, okay, along this side. So on the posterior side of the duodenum, and then we are having the pancreatic duct. Okay, they all joins at the part called the ampulla obvata. Okay, so the main pancreatic duct here is called what? The duct of Wesson. The duct of what? Wesson. Okay, and then we also have accessory ones. So assuming there is any obstruction, in that the main pancreatic duct becomes obstructed. Okay, those smaller channels, those accessory ones, then perform the function of the main pancreatic duct. Okay, so that is the anatomy. So anytime you are scanning, you also have to make sure that you scan your patient in the supine position. You can change your patient so that bowel, because the enemy of ultrasound is bowel. Okay, and this is the duodenum. It is a bowel. Bowels on ultrasound appear as well, dirty shadowing. Okay, so the patient should not eat, not per ox, and then fast. So you can, the patient can take in some water, not per ox, for about 8 hours. Okay, that is the protocol mostly that we use for abdominal organs, abdominal scans. Use a curved linear probe, okay, for your examination. There are certain landmarks that we are supposed to know, and then we talk about those things a few days ago. So we learned that, assuming this is the pancreas, okay, on this side, so for the landmarks, because we've taken, this is your probe, okay, this is the long axis of the probe, okay, so we want to take the whole section of the pancreas, okay, so on the epigastric region, you just place your probe and then you maneuver, okay. There are certain landmarks that you see, because we are taking the image in the short axis, okay. We are taking it along this side, a side like this, not this way, okay. So we see structures anteriorly, and then structures that are what below. So from the skin, the subcutaneous tissues, and then the rest. This should be your landmarks. You will see a vessel like a pear-shaped structure, and then one also vessel that is what? Round. So this one is oval, and then the other one is what? Round. How would you identify if this one is the artery or the IVC? Okay, so this is the abdominal aorta, and then this is what? The IVC. Okay, the aorta is round, as we can see in this part, this section, and then the IVC is what? Oval. The aorta is round, and then the IVC is oval. Now between the aorta and then this is a superior mesenteric artery, okay, SMA, because we did the normal anatomy, detailed anatomy, that is why I have to jump, okay, because we are dealing with the pathologists. This is the IVC, this is abdominal aorta. Between the superior mesenteric artery and then the abdominal aorta, depending on how you tilt your probe, there is a vessel, you see a vessel that passes anterior to the abdominal aorta, okay, so that is the left renal vein, okay, the renal vein, okay, draining into what? The IVC. At times, depending on also how you tilt your probe, you see a vessels branching off from the abdominal aorta, okay. At this level, we are the renal arteries, okay. So this side is the left side, this side is the right side. So the left renal artery, and then the right renal artery, okay. And then just anterior to the thoracic region, the thoracic vertebra, the vessels lies anterior to them. So this part is what? The thoracic vertebra, the vertebral body. Sorry, the vertebral body. Okay. Why are we getting vessel like this? No. Now note. We said from the first branch we can see the celiac trunk, common hepatic artery. These branches. When it enters, it divides into the left branches and then the right side, supplying the left loop and then the right loop. Okay, and then you further divide into smaller arteries to supply all parts of the liver. Now we also get the left gastric artery supplying the left side of the stomach, and then the splenic artery supplying the spleen. Okay, so we have a second branch, the celiac superior mesenteric artery. It is anterior to what? The aorta. Okay, so we can see that it is anterior as compared to the abdominal aorta, and then we are seeing branches from what? From the abdominal aorta. So assuming this is our vessel, okay, and then we want to cut across this way. Okay, we are cutting across like this. Okay, we can see some parts of the arteries here. Is that not so? And then we can also see parts of the arteries here. So this side is the renal artery, the right side, and then this side is the renal artery for what? The left side. Okay, that is why we are seeing something like this, depending on how you tilt your probe. This, are you okay? Okay, so from the vertebral body, anteriorly we can see what? The abdominal aorta. Anteriorly, we can see what? The left renal vein crossing anterior to this. And then we can see the superior mesenteric artery get anterior. Anterior to the superior mesenteric artery is what? The splenic vein. Okay, so we see anechoic tubular structure just anterior to what? The superior mesenteric artery. Okay, what and what forms the portal vein?
Splenic vein, SN.
Okay, so the splenic vein and then the superior mesenteric vein, they form the portal veins. Okay, now so this is assume this all this is the splenic vein. Okay, now when the moment you tilt your probe a little angle, okay, you realize that this one, the vessels here, the walls become what? Echogenic. So we had the portal splenic, so we call this point the portal splenic confluence. Portal what? Splenic confluence. Okay, so just a little, a very small angle, you can realize that this vessel here is now turning into what? Portal veins, and then entering into what? The liver. Are you okay? Alright. Now once we've been able to identify our structure, it is the role of sonographers to also, you are the sonographer, is it your responsibility, okay, to identify if the pancreas is normal or not. We have the same thing, echogenicity, echotexture, dimension, okay, and then the patient clinical history, very important. Now, the echogenicity between that of a child and that of an adult varies or differs. Okay? In children, the echogenicity is what? Hypo, maybe hypoechoic. And then in adults, the echogenicity means what? Hyperechoic. Why hyper and then why hypo? Our main reference point is the liver, point of comparison. Okay? So in children, the echogenicity is what? Mostly hyperechoic because they have less fat than what? Adult, the fatty content is what? High, and therefore the echogenicity between that of the child and then an adult will differ. Okay, so assuming you are scanning an adult, and then the normal echogenicity that you know, that is supposed to be hyperechoic, and now it is turning to hypo. It should tell you that there is something that is what? Happening. Okay, so echogenicity